Hi, I'm Hannah, a speech-language pathologist at Speech Language Planner. Welcome to my channel, and here we celebrate the beauty of communication. Today I'm going to talk to you about the SSI-4. Let's check it out. This is the Stuttering Severity Instrument. Let's open it up. I got this from Super Duper Publications, and I will drop the link below. Here is the examiner record form. You can keep track of your client's percentages of stuttering on here. And here is the manual that you will use. It's important to know if you're going to be evaluating a reader or a non-reader. If you have a client who is a reader, you can evaluate them using different grade level passages. If your client is below their grade level for reading, I would recommend choosing a passage that is below their grade level. That way, their stuttering or disfluency events aren't caused by the grade level being too difficult. There's also a picture description task in here for non-readers, and you could show them this and have them describe the picture. You get to take a sample of their spontaneous speech, having a conversation with them about anything they want to talk about. Oh, computerized scoring of stuttering severity. The American Speech Hearing Association, also known as ASHA, has a great practice portal for speech therapists to go to. I'll drop a link below to the stuttering section. It gives speech therapists information about different resources, treatment options, and testing options. This is Chewy, and the children love to see him during our telehealth video sessions. If you are a parent or a caregiver and your child has persistent stuttering, the stuttering events keep going past 6 months, or if your child tenses up, talking is just too hard, now is the time to seek the help of a speech therapist. Question of the day: what do you use as a speech therapist to evaluate a person who stutters? Do you use the SSI-4 or something else? Give this video a thumbs up, subscribe, and we will see you next time to continue celebrating the beauty of communication.